Which blood conservation technique involves taking patients' blood out before CPB and reinfusing it after surgery? A. Acute normal volemic hemodilution, ANH. B. Cell salvage. C. Modified ultrafiltration. D. Retrograde autologous priming. Answer: A. Acute normal volemic hemodilution, ANH. Explanation: in ANH, a portion of the patient's blood is removed immediately before surgery and replaced with crystalloids or colloids to maintain volume. The blood is stored and reinfused after CPB to restore red cells and coagulation factors. Why is normothermic CPB better for blood conservation compared to hypothermic CPB? A. It increases blood viscosity. B. It reduces platelet dysfunction. C. It increases coagulopathy. D. It increases systemic vascular resistance. Answer: B. It reduces platelet dysfunction. Explanation: normothermia maintains better platelet function and reduces coagulopathy compared to hypothermia, which can impair platelet aggregation and function, leading to increased bleeding. During CPB, which of the following best helps avoid excessive blood loss during cannulation? A. Heparin administration before cannulation. B. Performing cannulation without any anticoagulation. C. Hypothermia induction before cannulation. D. Keeping patients' blood pressure very high. Answer: A. Heparin administration before cannulation. Explanation: systemic heparinization prevents thrombus formation when cannulas are placed into blood vessels or heart chambers during CPB. Without it, clot formation could occur, causing dangerous complications. What is the target activated clotting time, ACT, during CPB to safely prevent clotting? A. 100 to 150 seconds. B. 200 to 250 seconds. C. 300 to 350 seconds. D. Greater than 400 seconds. Answer: D. Greater than 400 seconds. Explanation: an ACT greater than 400 seconds is typically maintained during CPB to prevent clot formation within the bypass circuit, ensuring safe extracorporeal circulation. Which approach helps reduce hemolysis during blood conservation in CPB? A. Using roller pumps with excessive pressure. B. Rapid suction and air-blood interface. C. Minimizing turbulence in the circuit. D. Using large-bore suction catheters. Answer: C. Minimizing turbulence in the circuit. Explanation: turbulence, excessive suction, and exposure of blood to air can cause mechanical trauma to red blood cells, hemolysis. Smooth, laminar flow helps prevent red cell destruction. In CPB, the major reason to use a hemoconcentrator is to A. Decrease hematocrit. B. Remove blood clots. C. Concentrate blood cells and reduce plasma water. D. Increase circuit priming volume. Answer: C. Concentrate blood cells and reduce plasma water. Explanation: hemoconcentrators selectively remove plasma water and low molecular weight solutes, thereby concentrating blood cells and improving hematocrit during or after CPB. Which technique minimizes exposure of blood to foreign surfaces during CPB? A. Conventional CPB circuits. B. Heparin-bonded closed-circuit systems. C. Roller pump with high suction. D. Use of large priming volumes. Answer: B. Heparin-bonded closed-circuit systems. Explanation: heparin-bonded closed circuits limit blood contact with air and synthetic surfaces, reducing activation of coagulation and inflammatory pathways, and conserving blood components. What is a disadvantage of cell salvage during cardiac surgery? A. Loss of red blood cells. B. Removal of clotting factors and platelets. C. Increased systemic inflammation. D. Increased need for crystalloid infusion. Answer: B. Removal of clotting factors and platelets. Explanation: cell salvage machines effectively recover red blood cells but remove clotting factors and platelets, which may still require supplementation after reinfusion. When performing acute normal volemic hemodilution (ANH), what must be monitored closely? A. Serum potassium levels. B. Central venous pressure, CVP. C. Hemoglobin concentration and hemodynamic stability. D. Activated clotting time, ACT. Answer: C. Hemoglobin concentration and hemodynamic stability. Explanation: since blood volume is intentionally reduced and replaced with crystalloids/colloids during ANH, close monitoring of hemoglobin and hemodynamics ensures that oxygen delivery remains adequate. What blood product is most often needed after CPB due to platelet dysfunction? A. Red blood cells. B. Fresh frozen plasma. C. Platelet concentrates. D. Cryoprecipitate. Answer: C. Platelet concentrates. Explanation: platelet dysfunction caused by CPB, mechanical trauma, hypothermia, hemodilution, often necessitates transfusion of platelet concentrates to control bleeding after surgery.